Hi everybody. Today I'm going to share with you a very important cine view of the cardiac MRI that is called short axis view. And you have to see here carefully, and I hope after this video you will get more informations about the cardiac MRI of this cardiac short axis view. You have to see here in the screen there is only a two sections of the two ventricles of the heart. Here is, you can see here, if I pause the screen here, you can see here this is a left ventricle and this is a right ventricles. You have to see here carefully. This is a left ventricle, this is a right ventricle. The walls of the left ventricle is thicker as compared to right ventricles, and these walls of the left ventricle is called myocardium, and this is very important. And you can see here a complete circle of the myocardial lining in the left ventricles, and inside there are some papillary muscles inside the left ventricles, you can see here. And this is papillary muscles, and this is a myocardial lining, and this is the right ventricles. And the short axis is very important view, I have already told you, and which we obtain as a stack from base of heart to the apex to look alveolar wall thickness and the wall motion of the left ventricles, which we can diagnose the alveolar wall thickness and wall motions. You can see here carefully. Then short axis view is very important view of the cardiac MRI, and there is a major finding when will you acquire the cardiac MRI of the short axis view. You can see here the myocardial lining. If there is any finding like a myocarditis, any kind of finding inside the in the myocardial lining, then easily you can diagnose the cardiac MRI. This is a systolic and diastolic. When we run the frame rate of the short axis view, you can see here a end of systolic and end of diastolic of the heart, and you can easily identify there any finding of the over the left ventricles. And this is some basic anatomy and basic things which I already told you about the short axis. And I hope you all guys you have understood what I have told you about the short axis. Thank you guys.